My name is Saeed Ali. I was riding my race motorcycle with my group. Within that racing that I did, I had a motorcycle accident, which causes me a lot of injuries, which one of them is brachial plexus, and the second thing is the neck, and the third of them is the scoliosis that I have. And you cannot imagine the pain that I had through those years. And I have been shifted to 3 hospitals. 2 hospitals was here in the country, and one of them was outside the UAE, which was in US. While I was on US, they told me that if we will do the surgery here in US, you will not be back to your feet again. You will be on your wheelchair, and you cannot walk. I was thinking about how I am going to do and to deal with this surgery. At that time, I looked to my mom because they told me that they have to cut my hand from down the elbow, and they will put the artificial hand so I can get a little movement on my hand with the brachial plexus that I have now. And I have to treat the scoliosis, which cannot be treated. I was on really massive pain. I couldn't sleep for 2 to 3 days unless I go to the hospital and take 1 injection and come back. And then they have started the medication. They have started step by step, and I was keep telling them I was on pain. They gave up. They really gave up. And I came back here to UAE, and one of the doctors told me about Dr. Nicandro. Dr. Nicandro said, while seeing the result of the MRI, he said that I can get you back to your feet. And I couldn't imagine that I will be on my feet once again. I asked myself, if I do the surgery, the last surgery that he told me about it, and I will be on my foot once again, I said yes, why not?
I had the chance of seeing Mr. Saeed upon the referral of colleagues from another hospital. He has had a very terrible motorcycle accident before, and he had the injury of his brachial plexus. So the nerve of his arm were removed from the spinal cord partially. So he had treatment outside, a few surgery done abroad. And the last surgery, which was in February of 2024, they made a posterior approach for the cervical spine to see the origin of the nerve for the treatment of the nerves. And when they closed the cervical spine, they put some plates and they rebuilt the spinal canal of his cervical spine. A few months later, 3 months later, he started to have weakness of his lower limbs, which were never affected until there. And then it was identified they had dislocation of the fixation, and the spinal canal started to be compressed by this bone and screws, and had spinal cord compression of the cervical spine after 3 months. So I had the chance of seeing him and analyze all his image, all his case deeply. It was a very complex case of spinal cord compression in multiple levels of the cervical-thoracic junction. Also is a very unusual area. After assessing his case with all the details, we saw that he needed another surgical approach to reopen his canal and rebuild it, make another construction, but stable without any compression on his spinal cord, to try to improve his neurological deficit. When he came to us, he was in a wheelchair, incapable to walk, with very different neurological symptoms and signs, and especially incapacity to walk. So he suggested urgent admission in the hospital, and we planned the surgery to be done as soon as possible. The surgery was performed a few days later. We performed posterior approach, meaning we open on the back of his neck and upper back area, cervical-thoracic region. We reopened the canal. We fixed the previous fixation. We performed a posterior cervical-thoracic fixation and stabilization of this area of the cervical-thoracic junction. So it was a complex reconstruction of his cervical-thoracic spinal canal, and it was done, and we achieved a very good result in terms of stabilization of cervical spine. And after a few months of physiotherapy and a proper rehabilitation, he started to walk again. His cervical-thoracic spine is well fixed according to the latest investigation, so he's having a good recovery as we are planning to achieve, and should continue the proper follow-up until the complete healing of his spinal canal and full neurological recovery, but at least now he's walking independently without assistance. What was interesting in the case of Mr. Saeed, that was really determined to improve. So I explained to him all the risks of this complex surgery, a lot of risks involved, and he said, yes, I want to go for this surgery. I know it will be painful, be hard recovery, but I want to give a chance to my spinal cord to recover and to walk again. And thanks God, thanks to him and the whole team here in King's College, we could perform the surgery as per the plan, a proper reconstruction of the spinal canal, and they gave space for the spinal cord to recover by itself, and with the help of the medication and physiotherapy that it was using on his case.
It was really a good experience. He had a miracle hands. He told me, and he was very honest, I will do the surgery for you and you will be back again. If you motivate yourself, you will be back again to your feet.
It was very interesting in Mr. Saeed that his character initially was a bit upset with the whole situation, several surgeries, suffering of pain, and this new issue, which was paralysis of his legs, which he never had before. So, but at the same time, he was a bit upset with the situation, which can happen, of course. He was keen to improve. So I had a very good surprise when I saw him last time, around 4 months after surgery, walking again on his feet without the need of the wheelchair. I can say that was a moment of really happiness and satisfaction of having the mission accomplished from all sides. Our side, from the spinal team, Mr. Saeed by himself, the rehabilitation team, everybody worked together and could achieve the best result that he could have for his spinal cord recovery.
This is the whole of my story, and thanks for Dr. Nicandro first, and thanks for King's College Hospital.